I chose Northwestern Medicine because I actually grew up near Northwestern Medicine Hospital, so I was familiar with the quality of care provided to patients, and so when I saw that they had a job opening, I was really happy to jump on that and apply because I knew the quality of care. I wanted to be part of that.
Northwestern Medicine was the whole package. The name itself in this area held prestige. That name spoke quality to me, and I wanted to be a part of quality.
They want what's best for the patient, but they also want what's best for the employee, and that all feeds back into the community. So they're investing in their employees, which is investing in their patients.
I chose Northwestern Medicine after being a student here. I had a great experience with a clinical instructor who was a great teacher to me. So I saw that and decided that this is where I want to grow as a professional.
I did both of my level 2 rotations at Northwestern Medicine, so I think just from that experience alone, I really felt welcomed at Northwestern. And I think when you're looking for a place to work, finding a family feel to your workplace, I think is something that's super crucial and important. It makes me excited to get up in the morning and eager to go and do what I love.
Everybody's so motivated to do better, to learn more, to invest in research. My whole team are always thinking about ways to help our clinic, to then help other clinics. And so we're just so determined to help.
I have a fabulous team. I think that is probably one of the reasons that I love my job so much, because anytime I have a question, I can go to any of my coworkers and talk things through, which is really helpful.
It's a family, and I think that's a culture that Northwestern facilitates, and it's one that I'm proud to be a part of.
Our providers work really hard to make sure that everyone is aware of what the patients need and will best serve them. Many of our clinics offer multidisciplinary care with speech, occupational therapy, and physical therapy. So we promote communication between all of those specialties, as well as between doctors and other staff that are involved in their care plans.
Northwestern Medicine has a philosophy about putting patients first, and patients first for us is making sure that the patient's needs and anything that they require are at our top priority. We really try to touch the patient in a way where we're speaking to them as a listener, not as just a practitioner.
I think the most rewarding part is seeing my patients progress and then the families have more relief.
Seeing their confidence boost as they start to meet their skills and they can keep up with their peers. I think that is really rewarding to see.
Just watching them smile and understand that there's that sun on the other side of the hill that they've been climbing for maybe sometimes 10 years.
That's what kind of makes you realize, like, oh, I did kind of make a difference for them.
Northwestern Medicine has a bunch of different benefits.
Great insurance. They match our 401k.
Reimbursable wellness fund, tuition reimbursement, paid days off.
I just really love my job and everybody who is a part of our team. As a new grad, this has been the best first job to have because I get to work with great patients and I get to work with great team members.
It's more than just work. I think it's a place where we share a lot of great memories together.
The clinical staff provides the best care to our patients. We have great outcomes, and it's great to see the genuine care for your teammates and the success of others.
I actually interned with Northwestern when I was a student, and I just felt like they were so committed to me excelling, and now that I'm here, I never want to leave.